my profession. Hey, everybody, thanks for coming. I'm just gonna wait like 2 more minutes. Let's a few more folks trickle in and then we'll get started. Yeah, and if people are interested in introducing themselves in the chat and where you're working or what you're up to, we'd love to know. All right. We're going to go ahead and get started so we can have as much time as possible with our wonderful speakers today. Again, thanks folks that have joined us. This is NASTAD's 5th in our 5-part series that was centered around housing and people who use drugs. Today is Section 8 housing or public housing restrictions for criminal justice involved people who use drugs. We are joined by 2 speakers. Our first speaker will be Mr. Frankie Roberts. He is the executive director of Leading into New Communities in Wilmington, North Carolina. And then we have the wonderful Margaret Bordeaux. She's the justice involved overdose prevention specialist at the North Carolina Division of Public Health. I will drop a link at some point into our chat today for anyone that's interested in watching any of the previous webinars if you haven't caught them. And we will also be throwing a link in the chat, and it's a survey for anyone that's here today or has attended any of the other sessions. We'd like to know what you've thought about the sessions, any things you might like to see in the future. So with that being said, I am going to hand it over to Mr. Roberts. Thank you.
Good afternoon, everybody. So as Billy stated earlier before everybody started logging in, yeah, I'm trying to still get used to this Zoom space and not being in the room with folks. So hopefully I don't disappoint you too much. So I'm gonna talk a little bit about, in my 15 minutes, a little bit about our work. We are a reentry organization here in Wilmington, North Carolina. We provide support services for people who've been formerly incarcerated. But our primary, one of the primary goal of our organization is providing transitional housing. We have a 45-bed residential campus here that used to be a jail. So that is where most of our work lies. So I'm gonna talk about homelessness related to people looking for home for somewhere to stay who might be justice involved, around Section 8 or any other subsidized housing and its access. But in order to speak to that, I have to speak from the reason that I got into this work. Because I got into this work in 1968. And I know I know I look really young, but in 1968 is where it started, where there was not a such thing as harm reduction. But that is actually what I grew up in. So my brother spent 2 tours in Vietnam. He was drafted in 1968, deployed to Vietnam about 4 months after he was drafted, found himself struggling with a heroin addiction. So he got, in Vietnam, you can almost get heroin at like going to the corner store. So he found himself really struggling to the degree that when he came back from his first tour, he volunteered to go back. And I saw several people that were veterans on here. So he was honorably, not dishonorably, honorably discharged 1971. I was 8 years old. He moved into the household with my parents. So when we're talking about housing, he was able to access housing because he moved into the household with my parents, my mother, father, and it was 3 boys. I was the baby. He was the oldest. But, or I should say, however, I became bitter and unforgiving over time. Because as I'm sure everybody on the phone knows, when we're talking about harm and people that's struggling with substance misuse, yeah, I was exposed, but fortunately, there is what is called women in America, because my mother was extremely forgiving and knew almost intuitively is that if my son is going to use heroin, then she felt like it was her responsibility to make sure he had somewhere to stay. And I'm gonna fast forward all the way until I became an adult, a barber. Became a barber. He went to prison, came out after 7 years. He struggled once he got out. I was still dealing with unforgiveness and inhumanity. That's what I'm gonna call it. I'm just going to be I was not necessarily a very humane individual because I wanted him out my hair and out my life. And so God showed me probably in early 98 that if it wasn't for his grace, that could have been me. So I want to say one thing to the group is when we talk about housing, and if we're talking about whether a person is in active use or not, we have to relate to people's hearts and people's minds. Because when we're dealing with politicians or we're dealing with public policy, most of the time we don't deal with it from our own vulnerability. At least I did. So it took my brother dying on my way to apologize for all of the years of mistreatment, because I literally was on my way to apologize, and he passed away before I got to the hospital where he was having a minor procedure. So he died suddenly. And I always believe he asked God to take his life because he didn't feel like he had the strength to be clean once he left that hospital room. So what I want to talk about for the next 7 minutes is when we're dealing with housing and the access for people again, that might be using, I think we have to deal with it from that place where we're vulnerable, and we got to come at it as advocates. And then almost create, and I'm gonna hit, in fact, me and Margaret already talked about this, creating some sort of simulator so that people can sit in that seat. Because you can't teach where you don't know and you can't lead where you don't go. However, I think if we knew what it felt like, I feel like we would deal with it from a different place. And I'm gonna tell you where this worked. This actually worked about 4 weeks ago in Wilmington. So in Wilmington, the New Hanover County Commissioners considered a civil criminal penalty to remove the homeless populations from the downtown library. So we got a big population of individuals in active addiction and homelessness around the library downtown. And certainly, you know, most of the rich folks and most of the people that love their downtown, like we do, don't want what they call an eyesore. And so one of the downtown organizations had a person that might have brushed up against one of their employees one evening. And so they made a big deal that, that they were assaulted by a person who was one of the homeless folks. And so as a result, they kind of engaged their network, and they got one of the county commissioners to consider creating this ordinance and making it a crime to be homeless in downtown. And so one of our county commissioners, who I would like to think a lot of us have appealed to over time, and we are his constituents, he said, I mean, in the open meeting, do we look at what we're doing? We are getting ready to exercise a legal ordinance, making it a crime for a person to struggle with addiction and be homeless around the library. And that ought to be criminal for us to even consider that. And so as the commissioner started to ring the bell tone in the meeting, the motion died on the table. And so that was a testament to me that when we see barriers, if we just advocate as though it was us, if we engage our circles of influence, if we engage our networks and really appeal to the humanity of it all and the forgiveness and understand if it wasn't for God's grace, that could be me. If we just continue to appeal to a person's human side, I believe we can make things different. Because obviously everybody knows that housing is should be a human right, no matter your mistakes or your challenges, and nobody wants to be reminded of their worst mistake. And so I think if we just start to really advocate like Brother Billy has intended for this to be, where people can talk and actually people can decide, hey, where does my influence lie? And then how can I use that influence? Certainly public housing don't allow people with criminal histories in. However, in North Carolina, the Attorney General, and I should have pulled a letter up, has created a pathway for people to go through what they call the continuum of care to be able to apply for some of the housing, and has prioritized individuals with criminal histories. And I think those are the type bandwagons that we need to be on. So it's 3:15, folks. So I would like to thank you for the opportunity just to share my personal experience and the things that I had to change to be in a place to reduce the harm. And I will say that, yeah, we have one or two places where a person can come and stay if they hadn't decided or are not in a position to not use. Thank you for allowing me to share.
Thank you so much. Margaret, if you want to take the floor, excited to have you.
Thank you. I'm excited to be here. Just still can remember when I received the notice about this webinar, and also the reflexive reactions I had to it, right? So the first thing that came to mind was my lived experience, of course, especially how the brain works. And then the second thing that came to mind was the other guest. I thought about how, you know, I rarely share this story. And I can think about I can probably count on my hand the number of people that I shared this story with, because it is so sensitive. Just because, yeah, it was a very challenging time in my life, but very enlightening and eye-opening too, right? And so my first reactions was, so when I replied, I was like, I don't know nothing about Section 8. Okay, and I'm saying that as somebody who was a consumer of the program for over 4 years, but I don't know nothing about Section 8. Only thing I know is my experience, right? And so it was very eye-opening to me. I have these same feelings about Medicaid and other social welfare programs I've been a part of. I don't know nothing about them. I can't tell you. But when I thought about my experience with Section 8, again, it made me very sensitive, because this is something that I don't talk about a lot. So before I get started into like how, you know, that experience, pull that out a little bit, I will say, for those of you who have never heard me spoke before, I have this very incredible gift where God gets me very close to stuff, sometimes in it, but not as thick as other people, right? I get that forgiveness that Frankie just talked about, right? And I get it. And so I'll tell you, it doesn't work like that for everybody. So I've noticed, like my estranged spouse and my daughter, as soon as they get sassy with me, they end up tripping or bumping their toe, and I'm like, swift retribution, right? And so that's how I always look at them. The way that I've been able to look at myself here lately is just my forgiveness has shown up in very incredible ways. I get right there. I get to see my consequences for my actions and my behaviors. I get to see the impact. I get very close. And then grace and mercy shows up in me in a very incredible way. And I think it's for reasons such as this. I think it's for me to tell my story. I think it's for me to talk about how grace really works in practice, what it really looks like, right? And how I've moved around all of these systems, a very incredible life. I used to be like, you should be tired, but now I understand that it's something totally different. In 2012, I was a girl with a plan. I'm here to tell y'all. My plan was, I had been on Section 8 for 3 years prior to that, and I had been working full time. But in December 31st, 2011, I resigned from my full-time job, and I said that I was just going to pick up something part-time, because my rent is based on my income, right? I felt very empowered to make this decision because I had Section 8, right? And I said, I'll go to school. I'll use my financial aid checks. I'll just take care of myself this way, right? Very much a girl with a plan. I was like, I have this Section 8. this is an opportunity for me to go to school, for me to relax and not worry so much. And I'll tell you, this is something I quit to people about all the time. When I was on Section 8, I was employed full time, and I recognized my privilege. I maybe had a little better of a job than other people who participate in that program. And so one time, my responsibility was $7.25 and Section 8's was $27. And so that is how that rental assistance looked like for me. So in the year of 2012, I was like, they about to pay my whole rent. I'm going to school. I'm getting me a degree. I'm really about to, I'm gonna make this change happen in my life. I had so many other things going on around me, and some of this was really like the impetus to change. But so I made that decision in January, early January of 2012. I went to the local Section 8 office for my recertification, and it was me and some other people who were in the room. This is not my only child syndrome showing up. This is some real stuff, y'all. It was me in a room full of people, right? And the 3 or 4 Section 8 counselors would take turns doing the presentation to everybody, right? And so we get to the part where it's my Section 8 counselor. She does the presentation. Again, it's a room full of people. She looks directly at me and she says, there's a zero tolerance policy. If you or anyone in your home gets caught with drugs, you will automatically lose your Section 8. And she looked at, and she said it every year before. She has said it every year before. It's a federal mandate that they had to say that part at that time, right? But why did she look at me? Why did she look at me? I was like, well, okay. You know what I'm saying? I was like, because, I think I'm really slick, Billy. So when I tell the rest of the story to y'all, I want y'all to understand why I was saying like, okay, right? Because she ain't talking to me. The lady looked directly at you, Margaret. What do you mean she's not talking to you? In January 27th, that same month in that same year, I was arrested. And during that arrest, marijuana was found in my home. And truth be told, it was other drugs in my home too. But the marijuana was found, right? And they tried to tell me how much marijuana it was, and I was like, they tell a damn lie. They've been smoking it the whole day, so there's no way it was that full amount still, right? I saw people smoking it the whole day, so that number was off a little bit. But again, they found the marijuana, and some old crafty business happened as well. But long story short, I as a result of that. The incidents of that night, I was charged with possession of marijuana in the school zone because the Head Start that my kids attended, how I found the home, was directly across the street from it, where I had raised my family for the last 3 or 4 years, where everybody knew how to come and find me. I was also charged with maintaining a dwelling, and it was the most offensive thing ever because I used to bust my ass, sell ass or grass to pay my rent, right? And you're gonna say I maintained that dwelling for that little bit of you? Do you see what I'm saying? Like, it was just really, to me, how I felt. It's not maintaining a dwelling, right? That's not what it was. That was the home for me and my children. Now, was the stuff that they said was going on in the house? Yeah. Things, you found the marijuana there. Someone I allowed to live in my house with me and my children made some decisions that my children and I also inadvertently had to face the consequences for too. Me more than my children, because they were very young at the time. They don't even. I asked my son today, does he remember where we were on Section 8? And he says, I just always know that you take care of that stuff. I don't know the difference. A house is a house. About a week later, maybe 2 weeks, again, I think I'm skating. I'm like, I ain't, my homegirl's like, you heard from Section 8? I was like, no, I'm good. I think I'm good, right? Not good, not good, not good, not good. Received that letter that says your Section 8 has been terminated. You have a right to appeal. You have a right to a hearing. And I was like, I want my appeal. I want my hearing because that wasn't my daggone weed, right? That wasn't my weed. Weed wasn't my thing back then, for real. Benzos was my thing back then. I had like random pill bottles all over the house. They ain't seen none of that. They honed in what they wanted to do. But that's why I said it was a lot of drugs in there. It was a very chaotic time in my life. So I don't deny that anything that they suspected. I mean, they had their rights to have their suspicions. What I'm saying is that's not necessarily what was going on. So I received that letter. And again, I really thought that this was going to be a hill that I could die on, right? Like that wasn't my way. And they were like, that's not the rule is you or nobody. There's a zero tolerance policy. And I went to my hearing, I showed up for myself and still very proud to be able to have the chance to do so, even though the official ruling didn't go in my favor. Lost my Section 8. I've been marginally ineligible for the program ever since then. It's also an overburdened program that has very limited access to it. I have been on the Section 8 list for 2 years prior to getting the voucher that I speak of, that I lost the opportunity so much. So when I first applied, my youngest son didn't have a Social Security number. That's something I had to provide for them to update that. So that was 2 years that I waited to be on that program. And then I shared my experience and I have indifference to it, but I've had a range of emotions about this throughout my life. But I'm on Section 8. Why the hell is my rent $7? You see what I'm saying? Like, what? How? This ain't a break. I waited 2 years for this and they pay $25 and I pay the rest. And then I made that big bold move to say, like, I'm going to use this social welfare program the way that I hope, you know, that whole American dream, chase that thing, go get that degree if you want to make more money, right? And not even 30 days from making that decision, my drug use behaviors, my personal behaviors, period, my social life caused this to happen to me. I'll use the next 3 or maybe 4 minutes just to talk about, to bring it on home to the initial point that I mentioned before. I get really close to shit. Oh, I get really close to things, right? And then, you know, grace and mercy just shows up. That's why I think these opportunities should be available to everybody. I was able to, this is going to sound, you can be like, this girl is crazy. I was able to, for an entire year or so, because this went on to March, as, you know, as I did the whole appeal and waited for all those dates. So from March of 2012 to March of 2013, I went without paying my rent in a very, very crafty way. No one could even imagine this. I couldn't even make this up. The home that I was living in went into foreclosure. The bank turned over the landlord property management responsibilities to a property management group in Cary, North Carolina. So they weren't familiar with the Wilmington market. And so my rent ended up being substantially less than what it had been when I was on Section 8. So that was kind of fascinating as well. And so with the folks who were managing it, and again, amazing people have shown up in my life in amazing ways. They would not accept partial payments, right? And so I thought I was so slick, you guys. I'm slick. I send those people like partial payments for a whole damn year, right? And they would just have to keep. So if I send it to them on like the 14th, they got it by the 15th, right? I met that deadline. Then they had to process it and send it back to me. And by the time that came, I was going to do it all again for the next month. And this kept going on. And I thought I was so slick, you guys. I thought I was so crafty because I had to do what I had to do to house myself and my boys, right? I was able to have an epiphany this year that showed me that the lady at the real estate company, because I can say like the bank that turned it over to that property manager, it was that lady. Me and her had a relationship. She was on the receiving end. I can't even tell you how many times she's probably had to fight her office manager to allow me to do this. That lady gave me grace and mercy. She gave me a year to get it together. She was an angel on earth. And in that year, I had an assignment that I didn't even understand. I fell into a depression, and I would go to that same library that Frankie talked about. I would sit with the people there. I felt a lot like them. I felt so marginalized during this time. I stopped using drugs and alcohol due to hospitalizations for a psychotic break. Like everything is going on, but I'm going to that library. I feel I'm hiding from a lot of people in the world. I just feel very comforted in that space. People do not judge down there. There was no judgment. People were very open to me. I was very open to them. I felt good, right? And so I know I'm crying now, but I'm just going to say something to make everybody laugh in typical Margaret fashion. There was this older gentleman, and he had took the responsibility of being like, my person. And he would always make sure, because I'm kind of naive. I get that. And I would always have a scam or two and have money and would look out for people. And I think that word got around. So he took the job like he would take care of me. And one day we were on a trolley and I said, well, we can get off here and we can stop and walk to my house. And he said, you're what? I said, my house. And so he didn't say anything else. And maybe it was a few days later, we were down back in the spot. And he said, guess what, everybody? Did y'all know she had a house? And so again, it wasn't something that I talked about, right? I didn't have to go down there and tell people that I do have a house. I'm not experiencing the same thing that you're experiencing. I could have did it at any time, but I just really did not want to even give the air. I get so nervous, right? Don't even want to give the air that I think I'm better than you, but again, knowing I got privilege, I just don't talk. I didn't talk about having a home, so nobody noticed that I had a home, because truth be told, I wasn't paying my rent that whole entire time. I was one action from being in the same situation as everybody. I could not see myself outside of that situation at any time. That lady allowed me a whole year. I can't believe it, a whole year to not pay my rent. And I thought I was slick, and the whole time she's being super nice to me. And so when you sent that these are the feelings that came up. Again, and I've talked about really sensitive things among other harm reductions before. Some of them know my Section 8 experience, but this one is really sensitive for me because I came really, 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 really close to what we know. Even with the mental illness, I had Medicaid at the time. Even with the substance use, all of the challenges I had at the time, the one thing that I would have said would have changed the whole trajectory of my life. The reason why I was able to go to the psychiatric hospital and come home in 3 days instead of like 14 and 21 days, like some of my other counterparts, because they did not have a house to get to. they did not have a home to be released to. I had that. I recognize that housing is a protective factor. And so these are the things that I think about when we have these conversations. And thank you so much for the opportunity.
Thank you so much, Margaret. Thank you for sharing your story with us. Thank both of you. Yes. We're gonna open up to question and answer now. But we did have a question early on from Anita Thomas, and this was for Frankie. Frankie, Anita wanted to know, did your mother allow your brother to use substances inside the house? I'm taking into consideration no harm reduction at the time as a way to keep her son safe or to use in a safe space.
No, she didn't. She didn't allow him to use in the house. In fact, it took her some time to really, accept the fact that he was using. And then afterwards, she just was always, always in a state of worry. And when he called, I've seen her go pick him up out the phone booth. I'm sure those of you know about heroin. It's a physical addiction where he was too weak to even stand up to use the phone, or stand up to get out the phone booth. He could use the phone to call her and say, I need you to come get me. And so I was the do boy that way. And I was going to say, I put in the chat the link to the article with the New Hanover County commissioners and what they looked at. I also put in the chat a document that it's like the North Carolina Housing and Finance Agency, which in North Carolina is one of the agencies that fund most public housing, and that's their tenancy agreement of who can get in based on what crimes. They all supposed to have a plan where they acknowledge to the public who they will allow access to rent. And that's what it looks like. And I was working with a group called the North Carolina Justice Center. We was trying to get them to go a little further with relaxing their criteria on who could get in. Good. And that was based on a criminal record. I just wanted to mention that those are the two things I put in the chat.
Thank you. Yeah, and we can, when we send out the recording, we can put those links in the email for folks. Does anyone have questions? Feel free to use the little raised hand feature, or you can go ahead and put them in the chat. We've got a question from Dorinda Wiseman. If you want to go ahead and unmute yourself.
Good afternoon, everyone. I'm actually calling from California. So my supervisor saw this meeting, so I'm joining because I actually work for the VA, part of their homeless program, specifically for the HUD BASH program. So I got on because, of course, everyone knows or believes California is like the best place to live. It's a hard place to live because everyone can't afford many of the areas. So even though everyone experiences, as Ms. Margaret even alluded to, there are certain areas, even with a voucher, it's still expensive. And in California, it's multiplied by that plus. So my question really is about, I used to also work with our formerly incarcerated individuals as well. And unfortunately, some of our veterans are also formerly incarcerated. So my question really is, what are some of the things that, and this is the first time I've heard of your organization, so this might be a broad question for everyone or your presenters. And I thank both of you for telling your truth in such a public space, because I know oftentimes people do not get the liberty of understanding the humanity behind situations. What other advocacy is out there in terms of sort of the specialized advocacy groups dealing with incarcerated individuals versus the specialized advocacy for homeless individuals? And the reason why I'm asking is, I know when I was part of criminal justice more formally, we talked about getting that checkbox off of a lot of employment applications so that therefore that was not going to be held against an individual. What efforts are there underway in terms of working or advocating on behalf of those that are formerly incarcerated and or those with behavioral health issues? I'd say behavioral health because mental health and substance use together, pretty much our category is behavioral health. But what other advocacy efforts are out there at a policy level to actually deal with HUD specifically? Because a lot of the rules actually come out of HUD. When I did chat, yes, I'm that old. So Frankie, you in the same boat, you know,
Yeah.
we don't but when I worked in child welfare, one of our biggest issues were our parents that we were reunifying. But because they had the substance use history, a lot of landlords or property management did not want to deal with them. And the same thing, and mind you, this is doggone near 20 years ago that I was doing that, and I'm back in the same boat with attempting to house our homeless veterans. So what other efforts are more at that macro level as well as micro level that may be not heard about, you know, across the country necessarily, or maybe in certain areas? What else is going on that some of our teams can try to at least hook into? Because right now we have a national effort with the VA to house 38,000 veterans by the end of the year. So, you know, I know we can do it. The problem is for those that have the barrier with the criminal history as well as behavioral health issues. What other tricks can we put in our toolbox? So thank you for my long-winded question, but
All good. Well, I was gonna say, certainly ban the box is one. We were successful here in Wilmington, North Carolina, with getting our county and our city to ban the box. In fact, after one meeting, and one of the things that I have learned is you got to have people primarily doing the presentations that is closest to the issue, that have been impacted by incarceration. So the guy who we brought in to talk with our county and our city attorney and county and city manager was a guy who had spent 4 years in the Alabama Department of Correction. He was living in North Carolina. He went to law school, got his law degree, and was able to appeal and get his law license. And so that's the type of work he do. And so when he came and talked to our county and city manager and attorneys, he was able to convince them that it was in their best interest to be able to ban the box. And our county did it exactly 6 months later. And he was able to even provide them with the policies that govern banning the box. So that is obviously a good one. One of the ones that we have been trying to, that we have had some leverage with or some movement with in our North Carolina legislature is expunctions. And that is in the last long session, we was able to get them to agree to expunge all arrest records and nonviolent misdemeanors off a person's record after 5 years automatically, and it was automated. So it was nothing anybody had to do. If they had a misdemeanor, 3 or 4 misdemeanors on their record, they fell off automatically. And we have been trying to get them to include certain felons, certain felony charges. We haven't been successful with that as of yet, but we were successful with, because if you are arrested, that shows up on your record. So when an employer does a background check and they see the arrest record, that also impairs or impacts an individual getting a job. So all of those fall off now automatically after 5 years as well. And I was going to say, this is impacts you in California as well as North Carolina, is the opioid settlement money. I know our county is meeting now with community members to develop a plan to spend those dollars. I don't know how much it impacted in Florida, but I know just in our county, in New Hanover County, so our state and then our county got $18 million. And so they are looking for creative ways to spend that $18 million, and it's $1 million a year every year, but looking to spend it in harm reduction programs, reentry programs related to substance use. So if you know your legislators, to reach out to them and again, ring that bell tone. And I always say, don't let them rest without real programs that impact real people that live on the margins of our society.
Awesome. Thank you. And I love all the suggestions in the box. So actually Cal Voices I have heard of. So thank you, Carrie. But I'll use those. Thank you.
Dorinda, and for everyone else, I have a couple of other links to a few other organizations. So as we go on, I'm going to try to throw those in the chat as well. Does anyone else have any other questions they'd like to ask?
I don't have a question, but if I may speak for a minute.
Please do.
Okay. I house homeless in my area, and I'm a new kid on the block. I've only been doing it just over a year. And of course, the homeless run the full gamut of criminal backgrounds, substance use, and mental health. Some of the above, all the above, or none of the above, you just never know. But when I have what I have done since almost immediately joining this area of work is I have went seeking all the landlord associations in the 5 counties I work in. And I pay the fee to be a member of the organization. I show up at every single one of their meetings. I accept every lunch invitation and offer many lunch invitations. And I have found that if I just say, Mr. Smith, I have this fella who's working real hard to overcome some of his background. He's still struggling, but here's the deal. Here's what I can offer to do for you. Could you help me out and give him a chance? And most landlords can't look me in the face and say no. And I've had very good luck housing some really difficult to house people. And many of them are known in the community as difficult folks because this is a small community. But I just say, look, these are the services. This is my cell phone. You call me anytime they're causing a disturbance. And I will meet with them and help them make some better choices for some of their behaviors. You know, it's not okay to beat on the walls at 2 a.m. You have a neighbor. Whatever the deal is, I will handle it. I will be there. I have your back. And I've had good luck with that.
Oh, thank you. And that's actually, I mean, I'm curious for folks that are attending, you know, for folks that are here on the webinar that are working in the realm of housing, any sort of, I don't want to say tricks or tips for trying to overcome some of those barriers, but anything that seems to work for folks, like, we'd love to hear it, or definitely encourage people to share. Oh, we have another hand up. Carrie, if you want to go ahead and talk.
Thank you, Billy, and thank you, Stacy. Carrie Manning, I live in Northern California, rural community, not a whole lot of housing. I was like, wow, I wish we had a landlord association that we could go, you know, talk to the landlords. But what we're doing is we are hosting a landlord appreciation event, or property owner, I'm sorry, they prefer to be called property owners, a lot of them. So we're hosting, I think, a one-day event, and all of the organizations around the county that work to house people are going to be at the event. We're going to provide lunch, and specifically for the landlords that we have worked with, that, you know, we can call up and say, you know, I have a mom with 2 kids, you know, this is her story, this is what we're trying to do. And, you know, they've said, okay, you know, and given people a chance. So that's the appreciation event. And, you know, we're hoping that some property owners will bring other property owners, you know, and we're going to make this like a, you know, semi-annual event, probably around the holidays, because what we have found is if you offer the case management to people that they're housing, then they're more apt to work with us. You know, just like Stacy was saying, you know, give me a call at 2 o'clock in the morning if you get a complaint, and we can, you know, help, or, you know, offer case management to the people that are being housed. So thank you.
That's the one thing. Thank you, Carrie. You brought up a good point. That's the one thing that I was gonna say earlier, is that I think case management is really important to all of it. And so I know even though I didn't completely understand like some of the Ryan White housing opportunities, Hopwood, Tiber and stuff, because again, I just don't understand Section 8 and HUD. It's just not a very understandable system, right? And so, but I knew who to go to, and I knew the folks in the community who were involved and interested in those programs, and just really looking at how you know, and I tell people all the time, like, I really think the Ryan White program is just really a staple in our public health system that we could rely on a little bit more. And like I always say, like, replicate Ryan White for hepatitis C care, replicate Ryan White for like homelessness. For anything, I'm going to say we need a version of Ryan White. I think that case management component is so important. We've seen the evidence, the retention in care, how folks stay engaged. And so I just feel that what, you know, both Stacy and Carrie have offered is just knowing, using that case management to really respond to some of the concerns that property managers will have, right? And so sometimes folks have all the interest in the world to say that I don't want to allow this opportunity to just anybody because it could have not so great conditions, right? So we have to understand that if we have folks where like some of their criminality, some of their behavioral health, some of their mental wellness, some of their substance use is chaotic and it's not being treated or managed, things will happen that will leave a bad taste in a property manager's mouth, right? People are coming to this with their own lived experiences. I guess that's a great way of saying it, right? And so we need to be very mindful of that. And that's why I think that case management or just having like peer support even is very valuable, how we can make like some of those connections for folks who have been marginalized, like having folks who are advocates, having folks who have understanding. Some understanding, again, I don't understand these programs, but I knew how to manage it. I knew how to make sure all of my TBRA folks got all of their information in on time, right? So that they did not leave this, right? They did not lose the, I don't want anybody to lose their voucher because the thing happened to me, right? So that's why I could show up as a case manager that way. And I just think that's a very effective system that I just, again, every opportunity that we have to, again, replicate Ryan White. Like, people have heard me say this before for so many different things, but just case management and peer support and just having folks who are available to respond for folks in this way, in ways that they have not been used to or had the opportunity to respond for themselves in the past. A lot of folks don't know how to advocate for themselves because they haven't been given those opportunities. And so just standing in that space for them as somebody who has experience on both sides, I think it'd be very valuable for a lot of these programs. And so I think, yeah, the advocacy that is probably going to be most important is like how we leave this webinar and we're more conscientious of like some of the things and how we can show up for folks in these spaces, because it is really, really hard to navigate. Because again, there have been, evidence on both sides. There have been experiences when people have possibly been exposed to or been a part of situations where it did not work out in the landlord's favor. It did not work out in the property manager's favor. And it's because the people who we're talking about probably weren't supported in many other ways, right? And so housing first, but still, if we're not addressing all of the other things, it's just that Band-Aid on that open gushing wound.
Yeah, I was gonna also say, I mean, the biggest thing, with our state legislators as well as our federal legislators is to get them to add criminal history to the Fair Housing Act, because it's not covered. That's why people can legally discriminate. And so most of our state Fair Housing Acts replicates the federal Fair Housing Act. And certainly a lot of times under substance use, you can, actively confront the system as it relates to disabilities, because that is sometimes considered a disability. But if you put if we can do a groundswell and get that added to the Fair Housing Act, that's 90% of the problem.
Wow, thank you so much. We've got time for one more question or comment. Tyrika Watson, if you want to go ahead and unmute.
Hi, actually, let's go ahead and go with someone's question that may be more of use in this space or supported in this space. Sorry, I have to go in like 2 minutes. I just wanted to say that peer supports are definitely needed in the space. Well, let me introduce myself. I am Tyrika Watson. I am a transition planner here. I moved from California. Now I'm in Portland, Oregon. And I work for both jails, overseeing transitional plans. And we are designed to kind of basically do a wraparound effect on individuals that are getting released from custody. So we're starting in custody, building relationships within the community that are either culturally specific, spiritually specific, and making sure that things are in line prior to the release. So I definitely agree with Margaret. You definitely should have a whole team, a whole village to support people who may have never felt supported in the beginning or throughout their lives. So that's my tidbit. Thank you so much. I enjoyed this space. Thank you.
Thank you for your incredible work, Tarita.
So I think with that, we're gonna wrap up. So I want to thank everybody for joining us today and for everybody who's joined us throughout the series. If you can, we would love any feedback you could give us in the feedback survey that I just sent in the chat. We're hoping to bring the series back maybe in the fall or next year with different topics. So any feedback you have on how it went so far, we would love to hear. And thank you for joining us.
Thank you so much, everybody. We appreciate you coming and your participation.
Thank you.
Thank you.